All right. Good afternoon and morning, everyone. Welcome to another Order webinar. Today's topic is a very important and critical one, specifically around agentless and unmanaged devices. So, regardless of whether they're legacy systems or clinical IoT, these devices create massive blind spots in healthcare environments. Fortunately, we're here with an expert from Emplify Health, who has gone through these challenges and come out much stronger. So myself, excuse me, I'm Asif Chowdhury. I'm a solutions architect here at Order on the customer success team. And today joining us is William, affectionately known as Smitty, from Emplify Health. Smitty, would you like to introduce yourself?
Thank you, Asif. And by all means, please, Smitty. I'm a security engineer at Emplify Health, specializing in vulnerability management. Emplify is a relatively new organization. We're in the process of merging two significant healthcare entities in the Wisconsin area. Currently, we're about 11 hospitals, 100 plus clinics, 67 different cities and rural communities served throughout 4 states: Minnesota, Iowa, Wisconsin, and Michigan.
All right, thank you, Smitty, and welcome. Thank you for joining us. So just a few reminders before we get started. The session is being recorded, so it will be shared through our socials, via LinkedIn and on our website after the session is complete. If you do have any questions at any point, please feel free to drop them in the box, and we'll get to them as soon as we can throughout this session today. So, perfect. Yeah, and today's session is actually unique because we're not discussing plans of segmentation. We're actually discussing things that Emplify Health has already done in their complex health system to achieve it. So let's get right into it. So a few questions, and we're going to break this down into a number of different portions. But our first kind of section is seeing the unseen. And some question, specifically what we have around this is, Smitty, what are some of the major blind spots that healthcare environments face today, especially with the growing number of connected devices and IoT and shadow IoT devices, and even legacy systems that are running, ancient versions of Windows OSs?
It's so tough to know what you don't know, right? And to give an example, now that we're fairly flushed out, we can say with confidence we're running around 100,000 endpoints in our environment. Trying to keep track of that manually in a CMDB is a profound challenge. You can look at other network tools and see things are connected, but you don't necessarily know what they are. So for us, one of the gaps that Order really filled well was taking that we know something is connected to the network, utilizing the machine learned profiling and saying it's using this type of traffic, it's using this MAC address, it's connected to this network. With a confidence score of X, we profile it as this. That starts to close the gap super fast. From there, that gap closing is so important because without that context, it becomes just beyond difficult to manage all the different vulnerabilities that are coming in. You take a healthcare organization and you've got IoT, you've got door controllers, you've got HVAC systems, you've got solar panel controllers possibly. Then you add all your IOMT, your glucose monitors, your pumps. You have so many things connected. And trying to keep all of that in an up-to-date format is incredibly tough. So having Order add that context, add that profiling, makes it a lot more approachable when you receive an FDA alert, industrial control system alert, and need to track something down and find out, do we have it? If we have it, how many do we have? Where is it connected? I talked a little bit about our overall environment. When you're spread across 4 states, trying to track down devices can be a challenge. So that's really, the visibility is the foundation for all the next steps.
Wonderful. Yeah, you're 100% right. And I think the way you started is incredibly important. You can't know what you don't see, right? And that's why having a tool such as Order is so important, providing the visibility and then the context on how to take action in your environment. That actually leads us right into our next topic, turning context into control. More specifically, when you started seeing these devices pop up in your environment, what were the bits and pieces of information from all the different high fidelity sources that were most important or valuable to you at Emplify?
Really, on a completely selfish level, because I live in the vulnerability space, the ability for Order to provide insight and classification based on MAC address, communication patterns, how devices are used, and to establish a profile and with confidence model numbers even really makes it simplifies my life a ridiculous amount, that I can go to forgive it, it's overused, a single pane of glass, and look and see and a great example is a week ago, CISA released 23 ICSAs. That's a lot to chase down, and to even go in and say, let's start by manufacturer and distill down from there. We'll just funnel down and to go, okay, we don't have that manufacturer in our environment. On to the next one. Okay, we do have this manufacturer. Now let's look at device profiles, and it really helps drill down quickly.
Yeah. Okay. Yeah, that's excellent. You're taking a segmented approach when approaching all these devices, which is great. It's a lot of data, but having all of the context behind it allows you to make that decision, which is excellent.
Yep.
Regarding vulnerabilities, since we were talking about that, let's talk about investigating the vulnerability edge, right? So for agentless devices like your medical devices and EOL, EOS, OS, medical equipment that's on-prem, traditional vulnerability scanners don't work. You scan it, it brings it down, which directly impacts your patient care. How do you approach assessing risk for those types of devices and even remediating them?
So that's a great point, Asif, and I'll expand on it just a little bit. Of our 100,000 endpoints that we manage in Order, about a little over a quarter of them are devices that are workstation servers connected to Active Directory or some other form of management that can support an agent, but that leaves almost 3/4 that can't. So you have a horrific challenge there identifying vulnerabilities, especially when some of those devices you can't actively scan them because there's just no way to do it. So Order really helps by understanding the communication and being able to process that down into even the software layer, what the operating system is, what software is installed. And by classifying the devices through the machine learning that allows the profiling, it really gives you a better understanding of what you have. And then on the back end, the managing the vulnerabilities. And I really just started digging into this a bit ago. The very fact that order is able to profile device, correlate that to an FDA alert or an FDA recall. I mean, we're not talking necessarily the traditional vulnerability in the sense that this could be exploited, but it's a whole nother section of risk and vulnerability that do we have a device that's subject to an FDA recall that may have not been actioned already. So it gives a great idea there. And looking at the communication patterns, orders looking at risky communication, it's looking to see, is something reaching out to a prohibited URL? Is something reaching out to a known bad domain? It just, there's so many points that are getting checked against. It really gives you a little better sense of confidence that there's nothing malicious in your environment. Or if there is something, an alarm is triggered and you have a pretty quick path to remediate that.
Yeah, that's a great point, because we don't realize how chatty some of these devices are, especially IoT or IOMT. And when you start looking at the flows and communication, it really makes your hair stand up a little bit.
And not even
all right.
just limiting it to IoT, IOMT, but
Sure.
I feel like a lot of people are going to be in the same situation where you have vendor managed devices. One of the ones that pops up in our environment is we have vendor managed devices that we're not able to install an agent on just due to contract restrictions. So knowing what operating system is there, what it's talking to, are they remoting into it? Who's remoting into it? Where are they remoting it into? Where are they remoting into it from? It's just having that visibility is super important.
Agreed. Yeah. And I think this actually leads us to our next point. When it comes to vendor managed devices, since you can't technically touch the device or it's unmanaged in yours, it's segmentation. It's operationalizing the segmentation approach in your environment. And a lot of organizations, this isn't exclusive to healthcare, they see segmentation as something very difficult. It's like climbing a mountain, right? What helped you at Emplify specifically with the segmentation process, and kind of where did you start in terms of that journey?
So I equate segmentation to eating an elephant. You got to pick a place and take a bite. But man, is it intimidating, especially when you're, looking at 100,000 endpoints. So the approach we took is we started small. We looked at what are our most vulnerable systems and where can we get some easy wins to get buy-in. Outdated operating systems was a great place to start. As a pretty generic example, we had a bunch of medical imaging devices that run Windows 7. Can they be upgraded? Absolutely, they can be upgraded. Is the cost absorbent? 100%. I think they were talking, $80,000 per workstation. Are they frequently used? No. And how do we absorb that risk without making bad decisions? And that's where we chose to start our segmentation journey. Things that really made it approachable were the orders flow genome, where we're able to look at traffic and see what is this talking to. That really helped us. Our specific environment, we use an integration with Cisco ICE. So that order and Cisco ICE are our segmentation tools, and being able to look at the flow genome in order and pretty readily translate that to a DACL in ICE. We were able to build out segmentation DACLs with very low pain points. But the real-time traffic monitoring was absolutely key for that.
Yeah. Yeah, it's nice to be able to visualize it, whether it's in the Sankey or looking at the flows outright. Um, uh, but that's incredible. I think that's in terms of segmentation, uh, as you mentioned, there's a lot of challenges that you face, but you took a really clear, kind of concise, you know, crawl, walk, run approach, which a lot of people forget to do. They try to tackle everything at once. You could have all the hours in the day, but it's still a beast to deal with. So,
Yeah,
yeah,
and
we
I'll
have
say
some
honestly,
questions.
as
Oh,
Steve,
sorry.
sorry,
No, no,
I'll
go ahead.
say honestly because that first bite was a tasty, successful bite through all the tools that
Yeah,
we utilize. Um, I, I was incredibly happy because having a successful first bite is really important for buy-in, in my opinion. And
sure.
we were able to get some great buy-in with our networking and clinical engineering teams by segmenting those vulnerable medical imaging devices to the point now our clinical engineering team is going out and looking for devices to segment because they're like, it makes our life easier. We worry less. We can better prioritize our work, and it makes the entire environment safer. So it's
Right.
been
Yeah.
it's been pretty spectacular to get that buy-in because we were able to easily put those initial segmentation efforts to good use.
And that's important. The fact that you had buy-in from other departments in your organization, um, that ensures that you have a holistic approach, right? You're not looking at it from just a security perspective, but also from a clinical perspective, networking, et cetera, right? And I think that is probably a very big contributing factor to amplify success in the segmentation journey. Not just segmentation, but visibility, right, for your environment. So.
Mhm.
Um, Great. Let's see. There's a few questions that are queued up. Let's dig into some of those. Let's see. Here's a good one. How do you keep inventory and profiling data current across such a large device footprint environment?
Well, the profiling data, that's a wonderfully hands-off approach because that's order backend. It's machine learning. It's updated as as net flows are learned and better understood. The classifications update automatically. Inventory can be a challenge, and it was one we absolutely had to work through. Our current device list, when I mention 100,000 endpoints, that's corporate endpoints. We also have multiple guest networks, and the way our sensor deployment is, we were picking up all those devices on guest networks. It could be someone coming to visit the hospital. That device is there for a day. Fortunately, on the more technical, and I don't know if you'd call it the backside, the ability to customize your data purge with DBA Commander, which is a YAML driven set of instructions that we look at it and say, okay, this device connected to our guest network, it received this authorization profile in Cisco ICE indicating that it was on the guest network, not seen for it's either 24 or 48 hours, it's purged from the system. So that DBA commander and the purge rules really help us keep an up-to-date and accurate inventory of what's on our network. Um, keeping the keeping it from growing exponentially was a big concern initially, and it took just a little bit to get worked out. But now that we've done that, I want to say, a year plus pretty much pain free on that.
It's awesome. Automation is very important. As you said, there's a ton of data that you have to sift through. So whatever you can kind of pass on to the system to do for you, it makes your life a lot easier, frees up your afternoon potentially. Um, to circle back on one of the points that we discussed when we were talking about segmentation, you mentioned getting buy-in from other departments. Uh, can you give the folks any advice on how they sorry, on how they embark on their segmentation journey? What did you do to kind of wrangle other departments in to be part of this process?
So security has had a great working relationship with networking. I've got a coworker that we're talking to each other on Teams on a near daily basis. So I had a great point of contact with networking, which was incredibly important because I feel like someone in a similar situation, security owns order in our environment, networking owns Cisco ICE. So we had that good working relationship because we have tools that work so closely together. That was incredibly important. And then it was finding a team with a vested interest in making sure their devices were secure, that they could support the devices they had. And we ended up starting with our clinical engineering team. Once again, existing great working relationship, but approaching it from the standpoint, we all want the same things. If we put a Venn diagram up, we all want devices that work, that are secure, that aren't negatively impacting the network with extraneous communication. And once we had that as the goal for all stakeholders, it was pretty easy to get the buy-in. Another thing that was very beneficial for us was segmentation has become a scorecard item for our directors and vice presidents, and allowing them to see our progress resulted in a lot of positive feedback coming to the teams. And I think that was incredibly beneficial too. When you're able to say, hey, we're doing good work, and we have metrics that show we're doing good work, and this month we segmented X more devices, everybody's pretty happy about that.
Yeah, it sounds like you took the customer success approach on that, Smitty. I admire that. That's a great. You're definitely talking our language. Let's see. There's a few more questions that are popping in. I think we're good on time. We are. Let's see. Talk to me about guest devices. What is your approach on handling them? They can create a lot of noise, so what is kind of your path towards handling or managing guest devices in your network?
So our guest devices are completely segmented off on a different network segment. We do have them populating in both ORDR and ICE. ICE is handling, some of the web authorization for that. We're definitely tracking them in ORDR, and it would be something that if we notice malicious traffic, we'd still see an alarm and be able to shut that down. But otherwise, we're not focusing on that because they are generally purged so fast from the environment. It is not unusual to watch our device count fluctuate by 1,000 devices on a day-to-day basis, just with everything coming through the guest network. And, to be completely transparent, we would watch it before we had our purge rules completely dialed in. We would watch it climb, 20,000, 30,000 devices, and then we'd have a bunch purged out, and we watched that ebb and flow. And it was just continually tuning to find what was the right purge rules for our environment. And that was absolutely a team effort between Emplify Health and ORDR. We had people on your team working with previous people on my team, just getting that dialed in. And fine tune, fine tune, fine tune, and then all of a sudden we hit happy point. And like I said, we do see some fluctuation day to day, but I feel like that's to be expected, and it's definitely not a pinch point.
Yeah, yeah, you're right. Any one person walking into a hospital system could have 5 devices on them, right? From their phone, laptop, watch. I don't think your headphones have a NIC, but they do have Bluetooth. But yeah, it's incredible the amount of tech, and even cars nowadays, right? Because Teslas or any EVs are connecting to wireless networks to get firmware updates or software updates. So
Absolutely.
over the air, yeah.
Yep. And all our
Um,
parking ramps have access points. So
there you go. So they're connected as soon as they, before they're even parked their vehicle.
yep,
Software update
absolutely.
started. Great. So in regards to the inventory to Amplify, who owns inventory, and in terms of ownership, how do you coordinate? Excuse me. How do you coordinate across teams when managing specific types of inventory, medical or otherwise?
So once again, honest and transparent as I come. Inventory is still a challenge for us because we don't have a unified CMDB. Um, Order is a great source for inventory, but we don't have the active integrations to really um, say we've got a congruent source of truth. Um, but we're hoping that's going to change this fiscal year. We're looking at a little different IoT, IOMT in CMDB product, which has a full integration with Order. And I don't do happy dances on webinars, but otherwise I'd be doing a happy dance because I know other customers that I've talked to are utilizing that with that integration and having profound success. So right now, our inventory at Emplify Health, it's kind of scattered. So we have, medical media, which has, we're teaching hospitals. So the amount of media devices we have is pretty significant. We have, of course, IOMT, all the clinical devices. Amplify Health has taken a renewable energy look, so wind farms and solar controllers. It's a little smattering of everything, and it's a little spread across multiple different departments. And Order right now is really one of the places where it all comes together. So by giving the teams, which I mean, you've got multiple different teams that have these responsibilities and these assets. By giving them access to Order, they have visibility on it, and we're able to utilize the business functions in Order to kind of segment what teams can view. So they're not getting, when medical media logs in, they're not hit with 100,000 devices. They're hit with their devices.
Right. Yeah.
And that's been a super nice and easy way to do it. The other thing that has really brought forward for us is it gives teams a really nice sense of ownership. So I'll have clinical engineering is a perfect example, and we do work with them super close and every single day. If they're having device issues, they'll go check Order before they even come talk to me. I'm seeing this. Could you just double check and make sure? Because it looks like it should be whitelisted and everything looks okay.
Right.
And giving them that ownership and sense of control has been super nice.
That's great. It sounds like you taught them how to fish in our data lake, so that's amazing. And to your point, yeah, we have plenty of use cases for an entire enterprise, right? It's not limited to just healthcare or network or security. There's people in all sorts of departments that will use it for asset management or tracking devices. So there's a lot of data at the end of the day. So it's just a matter of us shaping it to what you need it to do. Excellent. I think we have one more question. Uh, what's your advice for teams that are trying to start their segmentation journey? And specifically for those that don't really have a deep level of understanding or expertise when it comes to networking or segmentation?
A couple things. First, I would love to put in a plug for Order University, and I'm going to pick on Craig, who I see is in the audience. I said he probably joined just to hear me say this, but his masterclass on the integration between Order and Cisco ICE was absolutely one of the things that helped us really understand and approach segmentation. So the resources that Order offers in their Order University was absolutely spectacular. And then as far as additional things to operationalize segmentation, I think I touched on a lot of them already. Pick that low-hanging fruit. You know, take a small bite of the elephant to start with. One of the things we picked besides, the small group of vulnerable operating systems, we had medical devices that were deployed with a physical Cisco firewall in front of them. Well, we're a Cisco shop. We can easily grab what the existing DACL is off that Cisco firewall, translate it with the additional flow genome data we're seeing in Order to what we actually need and deploy that out. That was an easy, quick win. Get those easy, quick wins in. You get the easy, quick wins. People see, hey, this microsegmentation network or this microsegmentation isn't taking down our connectivity. It's not impairing the device's ability to do its job. It's not impacting the healthcare providers, and it's not creating additional work for me as a support team member. And that all those really help to get the ball rolling, get that initial buy-in. And when people see, and we've had some challenges, but people are eager to overcome the challenges because they know it's possible.
That's a great point. The little things add up, and getting those small wins do end up turning into a big victory for you. And it sounds like Emplify is doing a great job, especially with you spearheading a lot of those efforts, Smitty. To wrap things up, just want to reflect kind of on one point, like one key takeaway that if you could provide. Emplify is obviously way ahead when it comes to in comparison to other organizations in terms of your strategy and your efforts and segmentation. For things that we didn't touch upon specifically, and folks that are just starting out on the journey, regardless of whether it's inventory, risk analysis, or segmentation, is there anything else that you could provide as like a takeaway to kind of help them get that little push?
So it really, let's take it all the way back to the beginning. It really comes down to that visibility. If you don't have the visibility, everything else is 100% more challenging. When you have that initial visibility, this is what our network is, this is what's on our network, we can then start to define the buckets, and whether that be managing vulnerabilities, whether it be segmentation, once you have the visibility, everything becomes possible. Once you have some wins, everything becomes probable, and it's not a problem anymore. So
is someone writing that down? Really, I need to save that for a catchphrase.
it really comes down to having the visibility and knowing that you can find a place to start, because, and I guess that's probably a really good point, and I didn't come right out and say it, but having visibility, we wouldn't have known that we had, X number of medical imaging devices that have Windows 7 and identify that really good place to start. Or knowing that we had X number of devices behind a Cisco firewall. Someone knows that someplace,
Right.
but having that visibility in order means anybody who has access to it can go look at that, and
Right.
that it makes it absolutely wonderful. And especially when you're having those initial meetings, you know, it's everybody screen shares everything. To actually pull it
Yeah.
up and to be able to everyone see, everybody has that ability to contribute and work together on the same platform.
Yeah.
It made it very approachable.
The transparency fosters collaboration. Yeah.
I like
Smitty, could I
that.
ask you one last time? Could you reiterate that quote one more time, if you don't
Oh
mind?
man, I can't do that again. It,
It was brilliant. I'll have to go back in the recording and
I'm a
capture
goldfish. Thank gosh it's recorded.
it. Yes. Excellent. Well, awesome. Smitty, thank you so much. Really appreciate your insights, your expertise, your anecdotes. This is really enlightening for myself, and I'm sure for some of the audience that's here. Um, Thank you all for joining, and we'll see you at our next webinar. Take care all.
Thank you all.